Okay, so hi, evening friends, evening everybody, bache, evening everybody. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hematology, AIMS Delhi. So let us start with our MDS Pathology most important topics and the previous year questions. देखो बच्चे, before I even start with our session, I wanted to talk with everybody for the initial 1-2 minutes in the sense that mid-August is going on. ड्यूरिंग द मंथ ऑफ अगस्त मेजोरिटी ऑफ अस हम लोगों के ना इस टाइम पे दो थॉट प्रोसेस होती हैं वी आर इन आइदर वन ऑफ दीज टू सिचुएशंस either we are post interns who have completed almost majority of the subjects by this time. We are comfortable, we are done with about approximately 14 subjects by this time, are in the revision mode and are sure that whatever happens we will be picking our seat in this time. So the post interns are the most comfortable during the month of August, September. But to all of you, it's my very sincere advice and suggestion. Let's not, replace this comfortableness with complacency. We will need to work hard every day, every time. Each day, each minute, each hour counts. Much more important group for me right now is the intern group. Interns, हम लोगों को पता ही नहीं चल रहा होता कि चल क्या रहा है. In the sense that we are attending live classes along with the subject faculties. Sometimes we are able to attend all classes, sometimes we are not. Sometimes we give a post-class test, sometimes we do not. We go to the hospital every day. We get tired after that, not able to finish the subjects, have a huge backlog, and somehow are sitting approximately at 7 to 8 completed subjects at this point. So I want to devote this minute for our intern batch. In the sense कि देखो बच्चे अभी August is going on, mid-August. You have mid-September, mid-October, mid-November. You have at least 3 months at present. Do your first revision of the subjects extremely well. Cover just 2-3 subjects per month, but cover them well so that these 9 subjects that you will be doing in these 3 months, no question that comes from this, or majority of the questions that come from this will be right. Very few questions go wrong. We are sitting at 5-6 completed subjects. We will do 9 more. So if we are done with about 17 to 18 subjects by first week of November, after that we will revise before our NEET MDS exam. We will go and give the paper and get through. This will be my sincerest strategy for the current interns. Hi, evening dentist, evening everybody, bache. You are most welcome to ask any doubts, chip in with respect to the strategy firstly, and secondly, those of you who are the post interns, do write a statement for your juniors, because I am sure that you have gone through this phase. So do write a statement for your juniors about what is the best thing to be done during this time. Done. So let us start quickly with pathology. Path, it's a simple, straightforward subject. We have just recently completed it in our live classes also. So I'm pretty sure that all of you are comfortable with this. See, let's have a look at the MCQs. Simple questions. Path, 100% strike rate, simple questions. First is serum creatinine, urea and electrolytes are to be checked. Which blood test is to be performed? All these are the kidney function tests. We will do a renal profile. All these tests, serum creatinine, blood urea nitrogen, blood urea, electrolytes, that is serum sodium, potassium levels, all of these come under kidney function tests. That is why we will be doing a renal profile. Next question, something that is again asked in almost every paper and one of the favorite topics for the guys, I guess. Which of the following is most commonly associated with HPV? So before I go further, we can divide HPV into 2 categories, that is low risk versus high risk HPV. Which are the high risk HPV? Low risk are simple, 611, HPV 611 low risk, high risk 16, 18, 31 and 33. Everybody is aware of HPV 16, 18. I have added 2 more digits, 31 and 33. HPV is associated with squamous cell carcinoma cervix. It is associated with carcinoma cervix. Which one? Squamous cell carcinoma cervix. Which HPV has the highest association with squamous cell carcinoma cervix? HPV 16. Easy to remember. Which is the most mature age group? 16. HPV 16. By 18 years we have learned slightly. So HPV 16, which has a 70% association with squamous cell carcinoma cervix. Next, another important point, Kaposi sarcoma. Kaposi sarcoma is associated with which virus? HHV8. HHV8 is associated, or let me rephrase, Kaposi sarcoma is associated with two viruses, HHV8, human herpes virus 8, and HIV. Next point, HHV8 is associated with three diseases. So Kaposi sarcoma is with HIV and HHV8. HHV8 is with further three diseases, that is Kaposi sarcoma, primary effusion lymphoma, Kaposi sarcoma, primary effusion lymphoma, and Castleman disease. My pen is giving slight technical issues today, but not to worry. Castleman disease. Agreed AIDS and HHV8. Totally agreed. Next, this question is also re-asked as, which is the most common malignancy with HIV? Most common malignancy with HIV? Normally we tend to say it as Kaposi sarcoma, but no. It is non-Hodgkin's lymphoma followed by Kaposi sarcoma. Most common NHL with HIV being DLBCL, diffuse large B-cell lymphoma, followed by Burkitt's lymphoma. So, coming back to our question, associated with HPV is carcinoma of the cervix. Another question that is asked with malignant melanoma are the IHC markers. Firstly, melanoma. Stain used, M for melanoma, M for Mason-Fontana. So, we use Mason-Fontana stain. Next, IHC. On immunohistochemistry, it is HMB45. Immunohistochemistry, HMB45 and S100 positive. That is malignant melanoma. Next question. Which of the following is associated with HHV8 as is seen in the palette? So we just saw HHV8 is with three diseases, a commonly asked topic. Kaposi sarcoma, primary effusion lymphoma, Castleman disease, making the answer as Kaposi sarcoma. Next question. Coming to cell injury, which is the morphological pattern of reversible cell injury? Answer, bache. I want all of you to commit to this answer before I speak it out. Which is the first organelle affected in cell injury? First organelle affected, mitochondria. Which is the first biochemical feature of cell injury? What is the role of mitochondria in the body? Synthesis of ATP. So first biochemical feature of cell injury, reduced ATP, which occurs within seconds. Reduced ATP reduces the action of sodium-potassium ATPase pump, leading to influx of sodium and water. So the first microscopic feature of cell injury being cellular swelling. First microscopic feature, cellular swelling. All these are the first features. पहली गलती तो माफ होती है ना. So they are reversible in nature. Agreed. So cellular swelling, which is seen as hydropic change, which is reversible. Whereas necrosis, gangrene, calcifications, which these are permanent, irreversible changes. Next question. First marker seen in diabetic nephropathy is, diabetes affects the kidney by two patterns. Nodular glomerulosclerosis, it affects the kidney by morphologically by nodular glomerulosclerosis versus diffuse glomerulosclerosis. The most specific pattern associated with diabetes being nodular glomerulosclerosis microscopically, and it is also associated with the presence of KW lesions, that is Kimmel-Stale-Wilson mesangial nodules and lesions, KW lesions. Thirdly, the first marker seen in urine being microalbuminuria. There is presence of albumin in micro quantities, microalbuminuria. Next, all of you were right. Crazy. I love your name though, crazy people. Jyoti Vishwa, you were totally right with respect to microalbuminuria, but we learned two more things, that the most specific pattern is nodular glomerulosclerosis and it also shows KW lesions. Next, patient is a known diabetic on metformin, develops anemia, tingling sensation in peripheries and demyelination. Blood investigation shows hypersegmented neutrophil. What do I mean by hypersegmented neutrophil? Presence of more than 5 lobes in a single neutrophil. More than 5 lobes in a single neutrophil, or 5 lobes and 5% neutrophils. That is a hypersegmented neutrophil, and this is what it looks like. This is a peripheral smear picture. I am able to see RBCs which are well spread apart, and I am clearly able to make out that the examiner wants to highlight the neutrophil, which has 6 lobes, 1, 2, 3, 456. That is, it is a hypersegmented neutrophil, which is the first feature of megaloblastic anemia on peripheral smear. That is, it is associated with vitamin A deficiency. Agreed. Next, tell me this. Actually, I'm glad that you guys are responding well, because I'll be coming within the next 2-3 minutes. I'll be coming on to the microscopic images of peripheral smear. We'll cover that in this session. And out of those images, one image is always asked. So do reply me then also. Which will cause a faster healing in tissues. देखो बच्चे, hypoproteinemia, if the protein is low, if the patient is anemic or there is uncontrolled diabetes, these are factors associated with delayed healing. Faster healing is associated with hyperthermia. Plain and simple. Next, this is again a question I think which has been asked 3 to 4 times in microbiology also. Patient has community acquired pneumonia after stay in an air conditioned environment. The minute the examiner is talking of an air conditioned environment, we are talking of Legionella. There is only one answer with respect to air conditioned environment, that is Legionella. Firstly, now there are 4 questions actually which are asked on pneumonia. First, which pneumonia is associated with Auli appearance? Auli appearance is cytomegalovirus, that is CMV pneumonia. Cytomegalovirus, CMV pneumonia. Auli appearance is seen in 2 diseases: RS cells, Reed-Sternberg cells, Hodgkin's lymphoma, and cytomegalovirus, CMV pneumonia. Next question, which is the most common cause of atypical pneumonia? Most common organism associated with atypical pneumonia. I guess like us, even the laptop is slightly hungry today and it is missing out on few words. Not to worry. So how many of you have taken dinner vese? Firstly. Next, most common organism with atypical pneumonia, which is Mycoplasma pneumonia. It is Mycoplasma pneumonia. Next, overall, which is the most common cause of community acquired pneumonia? Strep pneumonia. Whereas community acquired pneumonia associated with air conditioned environment, that is Legionella. Next question. Next, G6PD deficiency will result in, it is the most common cause of RBC enzyme deficiency in RBCs. That is, it causes hemolytic anemia. Microscopically showing the presence of Haynes bodies and bite cells. Microscopically it shows the presence of Haynes bodies and bite cells. That is G6PD deficiency. So this gets us to our next 4 main images. I want all of you to be unbiased, everybody unbiased, and tell me what you see here. This is peripheral smear. Which is the abnormal RBC morphology associated? Usually the first thing that I hear is the presence of echinocytes. All these RBCs, they show spicules on RBCs which are equal in size and are equally spaced, also called as Burr cells. But it is an artifact. Artifact means there is no problem in the patient while making the slide this happened. So I will not even report it in my peripheral smear report. Which is the abnormal RBC? Look at this one. You are able to see the presence of DNA remnants called as Howell-Jolly bodies. So diagnosis, Howell-Jolly bodies. Seen in megaloblastic anemia. Smudge cell nahi bache, not at all, Jyoti. The minute we talk of smudge cells, we are talking of CLL, chronic lymphocytic leukemia, which is a blood cancer. Therapy of which is about 25-30 lakh. Versus Howell-Jolly bodies, which are seen in megaloblastic anemia, the therapy of which is vitamin B12 tablet, 10 rupees, and the prognosis is excellent. So Howell-Jolly body is seen in megaloblastic anemia, post-splenectomy and thalassemia. Next question. All the guys, which is the most double meaning fruit? This is a banana. It shows the presence of banana-shaped gametocyte. Diagnosis, banana-shaped gametocyte seen in Plasmodium falciparum. Next point, whenever we will have a look at malaria, we will see both the gametocyte as well as the trophozoite. The trophozoite form shows the presence of 2 rings with multiple large Moriar's dots. Falciparum is the most severe malaria na? Patient की मरी हुई हालत है. So 2 rings with Moriar's dots called as the ecole form of Plasmodium falciparum. Next question. Give me a right answer in this, especially all the girls, bache. I mean, you are able to recognize this slide usually extremely well. What do we see here? First, identify the abnormal RBC morphology. Look at all these RBCs. Look at all these. देखो, we tend to get distracted. हम लोगों को ना आंसू पहले नजर आते हैं. We tend to see tears before. So guys, we usually think of teardrop RBC, which is a feature of primary myelofibrosis. No, the main finding that you are able to see here is basophilic stippling. You are able to appreciate the presence of RBCs with blue dots on it. That is basophilic stippling. Most common cause of which is lead poisoning. What are the other features that you are able to see in this microscopic slide? We are able to appreciate the presence of target cells. These are RBCs with a central hemoglobinized dot, target cells, teardrop RBCs, and basophilic stippling. The main finding was basophilic stippling. Next question. Next question. Answer, bache. All the girls, you love this. And guys, we are afraid of it. Answer. What do we see here? I want you to commit to it. See, do not worry about the fact whether you will be right or wrong. Does not matter, but commit to the answer. Identify the abnormal RBC. That is this one. It shows the presence of a ring. You guys, we are slightly afraid to commit now. It's a ring. Cabot rings. Cabot rings seen in megaloblastic anemia and postplenectomy. Cabot rings. Cabot rings. And lastly, teardrop RBCs, which are seen in primary myelofibrosis. This is teardrop RBCs, primary myelofibrosis, also called as dacrocytes. Teardrop RBCs or dacrocytes seen in PMF. Think of it yourself. When there is excessive fibrosis in the bone marrow, when the RBCs are coming out of the bone marrow, they become teardrop in shape. Teardrop RBCs or dacrocytes. Next question. Next question. Patient has low hemoglobin, low platelet count with presence of monoclonal antibody spike on serum and urine. The biggest hint examiner gave you in this question was the presence of M band or monoclonal spike or a M band on serum and protein or serum and urine protein electrophoresis, which is a feature of multiple myeloma. What is multiple myeloma? It is a plasma cell dyscrasia. It shows increased number of plasma cells. It's a plasma cell cancer. It has increased number of plasma cells with any one CRAB features. CRAB stands for calcium is increased, renal insufficiency, anemia, and bone lytic lesions. Increased number of plasma cells with any one CRAB features is multiple myeloma. In urine, it is also associated with presence of Benz-Jones proteinuria. Benz-Jones proteinuria. On protein electrophoresis, it shows a monoclonal band, that is M band or M spike. Next, the main cytokine responsible for multiple myeloma being interleukin-6 overexpression. Interleukin-6 increases, which in turn increases the proliferation of plasma cells. And clinically, the classical clinical history is elderly with low back pain. Elderly with low back pain. This is multiple myeloma. Next question. Next question. This is an interesting one. Answer, bache. This is something that sometimes we tend to go wrong in, but has been asked repeatedly, is straightforward. Which is the cardiac valve involved in IV drug uses? Dekho, examiner is talking of vegetative endocarditis. There are 4 vegetative endocarditis. RHD, rheumatic heart disease, infective endocarditis, NBTE, non-bacterial thrombotic endocarditis, and LSC, Libman-Sack endocarditis. That is SLE affecting the heart. Libman-Sack endocarditis, that is SLE which affected the heart, SLE affecting the heart. In the first 3, that is rheumatic heart disease, infective endocarditis, and NBTE, the most common valve affected is mitral, followed by aortic valve, that is the affect left side of the heart. Except Libman-Sack endocarditis, where most common valve affected is mitral, followed by tricuspid, that is Libman-Sack affects atrioventricular valves, mitral followed by tricuspid. It affects atrioventricular valves. Next point, infective endocarditis. So what we have learned is that the most common valve affected is mitral followed by aortic. except in IV drug users. Because if the patient has taken an IV drug, intravenous drug, from the venous supply, the blood will go to the right side of the heart and it will first affect right side of the heart. It affects right side. That is, tricuspid valve is affected. And the most common organism associated with IV drug users being Staph aureus. These are very, very important points. Most common organism being Staph aureus. In IV drug users, this was most common. In IV drug users, when left side of the heart is affected, in that case, the organism is Enterococcus. In that case, it is Enterococcus. First class. So this takes care of our 12 topics which have been pretty commonly asked in our recent PYQs and must know topics for your MDS exam. So, bache, on this positive note, needless to say, bestest of luck from the bottom of my heart, no doubt about it. Those of you who are already our students, you know well that pathology has been covered and you guys have done it extremely well. And I'm sure that you will be able to answer majority of these questions. Firstly, micro will be starting very soon. For the students who are interns, who are still dicey about the fact that should we join this time, should we give a serious attempt, or should we start preparing for next year, but you do not give up. The minute you start giving up na, it means कि तब तो पक्का नहीं होगा. Give it a fight and the result will be much better than you expect. So we follow that 3 subjects per month strategy. Next 3 months, let's finish off these 9 subjects, especially for the interns. 4-5 तुम कर चुके हो and you will be sitting at a much better position than you can imagine. Done, bache. So on this note, take care and have a well-deserved dinner. Thank you.